Earlier on we looked at CPPD, where we said that CPPD is known as what? Calcium Pyrophosphate Deposition. So of course you know that there's like a crystals, right? Some couple of crystals being deposited in the joints. Do you understand? So now say this CPPD has different types, all right, which we promise that we'll be looking at different types. So this one is another type, and when we say that something is asymptomatic, we simply mean the disease condition is there. Do you understand? But the patient has not started complaining yet. That's just what asymptomatic means. So for asymptomatic CPPD, all right, we said that it refers to the presence of the calcium pyrophosphate dehydrate crystals in the joint, quite alright, but the patient is not showing up any symptoms yet. There's no pain, there's no swelling, there's no inflammation. Do you understand? So you just incidentally discovered it, not that the patient complained about it. You understand? So definitions, first of all, you should know that if this calcium pyrophosphate deposition crystals, they are found in synovial fluid or joint cartilage. Typically you identify them via x-rays, okay, then or microscopy analysis. Do you understand? But we are saying it is asymptomatic simply because the patient is not showing off any symptoms. The patient is not complaining about anything. So common sites where you see this, that's deposition of these crystals, is the wrist, the knees, the hips, the spine. You understand? Dictation often revealed through what? Images, so radiographs. Okay, so why it matters? It can be a marker of underlying metabolic conditions. All right, so it could show that maybe the patient has hemochromatosis, or maybe a parathyroid hormone that is overfunctioning, a gland that is overfunctioning. Okay, so of course if it is asymptomatic, it can as well progress to having symptoms, right? That's when we say it is pseudo. That's mimicking goat, all right, but it is not goat because goat is caused by uric acid crystals, not calcium pyrophosphate crystals. You understand? So it could be pseudo, which is acute or chronic. Okay, so it can mimic other joint diseases, so you should always rule out osteoarthritis, rule out rheumatoid arthritis, you know, and all of that. Okay, so management approach, no treatment is usually required since it is asymptomatic, but keep monitoring, and basically we have stated the risk factors which you should tell the patient. You understand? If they have any of the risk factors, you try to adjust. Then patient's education is important. All right, very important, because you don't want this disease to progress to having symptoms. Okay, so that's it for asymptomatic CPPD.